Are you dealing with sciatica or lower back pain and looking for the most effective way to stretch your piriformis the right way? Hey guys, welcome back to my channel. I'm Jessica, an athletic therapist with over 10 years of clinic and field experience and a final year osteopathy student, providing the best tips and tools for living a healthy, fit, and pain-free life. So if you're new here, consider subscribing. So in today's video, I'm gonna talk about the most effective ways to stretch your piriformis to relieve the tension and compression on the sciatic nerve. Because I value your guys' time, I've also placed timestamps in the description below so you can jump around, or if you want to go back and review any sections that I've covered, you can do that. So what is sciatica? Sciatica is the pain that is radiating down the path of the sciatic nerve. There are several different spinal conditions that can cause sciatica. Most commonly occurs from a herniated disc. There's also piriformis syndrome, and this is when the sciatic nerve, because of the route that it follows, get compressed and entrapped within the piriformis muscle, and this can increase pain, create sharp burning, pain locally in the buttocks region or down into the hamstring. So I'm gonna show you two positions for one specific stretch. So one's gonna be sitting and the other one's gonna be lying down on your back. Usually I prefer the lying down one because your spine is unloaded and you're in a more relaxed position. But if you're comfortable enough to do this sitting, you can try either or. So for the first position to stretch the piriformis, as I mentioned, we're gonna do one in sitting and then one lying down. So the first thing that you want to do is you want to find a chair or a bench at home that will allow you to be 90-degree angle with your knees and hips so you are parallel with the floor, as you can see here. The second thing that you want to do is you want to make sure that you have a neutral spine. So often when I see people do the piriformis stretch, they kind of are in this slouched position where they're bent over their leg and they're putting weight on the knee. So what I want you to do is, if you don't know what your neutral is I want you to rock all the way into extension and then into flexion, and then your halfway point is usually around your midpoint. Just make sure that you're not in that rounded position because that actually can make your symptoms worse. So once you've got your neutral spine and you've got your seated position that you're parallel with the floor, I want you to grab the affected side. You're going to bring it across onto the opposite leg. Now what I want you to make sure is that you do not place it on top of your kneecap. Bring it slightly above, and also make sure that your affected leg is over the other leg a little bit more so that you're not resting your ankle on the knee. So the last thing I want you to do is strain these ligaments in the ankle. Now, if this position also is a bit too tight and you find, okay, I can't really get my knee down, what I suggest is you use a stool or a bench or another chair, and you would have this leg resting on there just a little bit lower so it's not as tight, or if it's too painful, then you have a little bit more room. So once you're in this position, you're in that neutral spine, I want you to gently put your hand on your affected knee. You're just gently gonna bring it down towards the floor until you feel a gentle stretch. So initially when you're doing this, because the discomfort that you've been in, you might feel a little bit of pain, but what we're looking for is that as we go through this stretch, it starts to subside. So the stretch you should hold for 30 seconds. We're gonna do this 3 times on each side, so do it on the opposite side as well to give you the rest in between. And then the other thing, it's a little tip, based on the anatomy of your piriformis, you want to extend a little bit more your sacrum. So what I mean by that is that when you're in this seated position, when you extend the tailbone back towards the behind you, you are going to help isolate and lengthen that muscle a little bit more. So by doing that and then gently press down, you can accumulate a little bit more tension as it starts to feel like it's easing. And then once the 30 seconds are done, you're gonna switch and do the opposite side. Now for the lying down position, like if this is too uncomfortable for those who maybe the sciatica is more coming from a herniated disc, a lumbar spinal disorder, then I would suggest that you would do the supine lying down on your back position. So for this position, we are going to have you lying down. My favorite position for this one is actually lying on your back and having one foot, so if it's, say your right leg's the affected leg, having your left foot up against the wall so you can be completely relaxed, because I know a lot of you are probably used to seeing those piriformis stretches where you have one leg crossed and you're holding onto the opposite leg and bringing it in towards your chest. But often what I find is there's too much strain and tension on your spine because you're trying to accumulate and you're kind of in more in that curved, slumped position, which actually can aggravate the sciatica even more. So let me show you how that one is done. Lie on your back, and I want you to also find that 90-degree angle, one foot up against the wall, so it would be your left foot up against the wall, and or the right leg up against the wall, whichever side's affected. Then you're gonna cross the opposite side just like we did in seated, and I want you just to gently push that knee towards the wall, and then you are going to gently extend, like push that tailbone down towards the ground and hold this stretch for 30 seconds. Nice and easy, again, like I said, gentle stretch. Once you start to feel like the tissue is loosening up a little bit more, then you can apply a little bit more pressure down towards the ground with your sacrum, and then a little bit more pressure with your hand against the knee towards the wall. So comment below if these stretches were helpful. I would love to hear about them. How can we prevent sciatica? So one of them being postural, so making sure that, you know, when you're sitting, maybe you have some lumbar support, so maybe use a towel or get a pad for the back, so then that way you're sitting in a nice neutral position. And then making sure that you're sitting with a 90-degree angle with your knees and hips to the ratio to the ground, and your feet are flat. So you're equally sitting on both sit bones and you're not leaning against one side. The other thing is strength. So it's really important to strengthen the glutes, strengthen the pelvic girdle, make sure that you have a strong core. And lastly is good mechanics. We want to make sure that, you know, when we're lifting things or placing things down, that we are using our legs and the movement is coming from there, not from our low back, and we have a slight bend in the knees. We're not twisting as we're trying to lift or place something down. That will really help to reduce the risk of injury or it reoccurring. So now you know my favorite piriformis stretch to effectively release the sciatic nerve. I really hope this helps. If it does, give me a thumbs up and leave a comment below. I would love to hear about it. And thanks again for watching the video. And if you haven't already, subscribe and share this video with your friends and family.